Brenda and I have many videos on how to care for regular urinary catheters, but now let's talk about another type of catheter called a suprapubic catheter. It's also a hollow, flexible tube that's inserted into the bladder to drain urine. But in this case, it is surgically inserted through the lower abdomen and directly into the bladder. It's an alternative to a urethral catheter and is commonly used for individuals who have difficulty with normal urination and due to medical conditions like urinary retention, spinal cord injuries, Parkinson's, after certain surgeries. Oftentimes, these patients have started with a urethral catheter but have had complications, or they're just going to need one for a long, long time. So again, instead of using a catheter inserted into the tip of a penis of a man or the urethral opening inside the vaginal vault of a woman, the suprapubic enters directly through the lower abdomen, and it does take a surgical procedure. The initial catheter is usually a smaller French, and French is the term that describes the circumference or the size of the tube. Often it's a size 16 and it's inserted, but as the opening heals, the size of the catheter may be increased. In fact, you may see many suprapubic catheters with a size number 20 or 22 French. The larger tube size really helps to minimize clogging if someone produces a lot of urinary sediment, or if there is blood or blood clots in the urine. Suprapubic catheters are generally very safe and have quite a low risk of complications. Remember, a suprapubic catheter is preferred for long-term catheterization and when there is urethral damage. And remember that urethral catheters are often used for short-term needs when drainage is necessary. Many patients actually find suprapubic catheters much more comfortable because they're due to that less sensitive insertion area. Urethral catheters also may have a higher risk of urinary tract infections due to the presence of bacteria around the opening, and that's because the urethra is close to the rectum and the E. coli and bowel movements can really cause urinary tract infections. Of course, there is a risk related to the insertion of a suprapubic because it's a surgical procedure. So how do we care for a suprapubic catheter? We're going to do that in the very next video, so stay tuned. Go to our YouTube site, the Hospice Care Plan, and watch for this next YouTube. Sign up so you get our information every day. Go to our website, the Hospice Care Plan. Brenda and I are the Care Queens, and our motto, care is treatment.